Have you ever bent down to tie your shoes and felt like your face was about to explode? Pain in your cheekbones, pressure in your forehead, discomfort behind your eyes, a blocked nose, thick mucus, constant fatigue, and the worst part, you go to the pharmacy, buy something quick to unblock your nose, and without knowing it, you might actually be making everything worse. Today I'm going to explain what sinusitis really is, why it happens, which common mistakes make it worse, and most importantly, what you can do at home to relieve it and prevent it in a safe and effective way. Before we continue, subscribe to the channel because this kind of clear, useful information can save you a lot of pain. Literally. What is sinusitis? Let's go step by step. Look at your face for a moment. Your forehead, your cheekbones, the area behind your nose. Even if you don't notice it, those bones are not solid. Inside, they have air-filled spaces that connect to the nose through small channels. Those spaces are called the paranasal sinuses. And they're not there just because. What the paranasal sinuses are for, the paranasal sinuses perform very important functions. They humidify the air you breathe. They trap microbes and particles. They help your immune system. And they even influence your voice. Their entire interior is covered by a special mucus membrane that produces mucus. That mucus is not dirty, it's defense. It traps bacteria, viruses, and fungi, and thanks to tiny microscopic hairs, it is slowly swept toward the throat so that stomach acid can take care of the rest. The problem starts when this system gets out of balance. So then, what is sinusitis? The word says it all. Gerwetz means inflammation. Sinusitis is inflammation of the mucous membrane that lines the paranasal sinuses. And why does it become inflamed? The most common cause is allergy. What is allergy and why does it cause sinusitis? Allergy is an exaggerated response of the immune system. A simple example, a bit of dust or animal hair enters the nose. In most people, nothing happens. But in someone allergic, the body reacts as if it were a huge threat. The immune system attacks, and in that attack, it damages the mucosa, inflames it, and causes excessive mucus production. That mucus becomes thicker and starts blocking the drainage channels. That's where the real problem begins. When mucus builds up, when mucus can't drain, it stagnates, it thickens, it accumulates inside the sinuses, and that closed, warm, humid environment becomes the perfect breeding ground for bacteria and fungi. That's when infection appears, and that's when, many times, you need to see a specialist. But the important thing is this. There's a lot you can do before reaching that point. Factors that make sinusitis worse. It's not just allergies. There are things that constantly inflame the mucosa. Smoking, a deviated nasal septum, nasal anatomical problems, poorly treated chronic congestion. All of that keeps the nose producing mucus nonstop. Classic sinusitis symptoms. Sinusitis doesn't show up the same way in everyone, but there are very clear signs. The most important one, pain. It can be felt in the forehead, in the cheekbones, behind the eyes, or deep inside the head. One key detail, when you lean forward, the pain increases. That's very typical. You may also notice extreme fatigue, a general feeling of weakness, mild fever, lack of energy. Because when there's an infection, the body feels it. Mucus, color and meaning. This is important. Mucus says a lot. Clear, good hydration, yellow and thick, infection and poor hydration. Deep green, possible active infection. Brown or bloody, irritation from excessive nose blowing. Bleeding usually happens because small blood vessels break from constantly cleaning your nose. Nighttime cough and postnasal drip. Why does sinusitis cause coughing, especially at night? Because mucus doesn't only drain forward, it also flows backward into the throat. When you lie down, gravity does its job. That drip irritates the larynx and causes an annoying cough that won't let you sleep. And poor sleep makes everything worse. If this is being helpful, give it a like and subscribe. That way YouTube shows this content to more people who need it. Let's continue. Home treatments that actually work. Let's get practical. First, nasal sprays. Saline nasal sprays are safe and very effective if used correctly. And here's the most common mistake: how to use nasal sprays correctly. Don't aim upward. Don't aim straight to the center. The nozzle should go at a 45-degree angle, slightly toward the side, as if pointing underneath the eye. You apply 3 or 4 sprays, hold for a moment, breathe gently. Don't blow your nose forcefully afterward. Just clean whatever comes out. This allows the mucus to become more fluid and easier to eliminate. Nasal rinses. Rinses are even more effective. You can do them with a syringe, saline solution, filtered water with salt. The key is technique. Head tilted, mouth open. Breathe through your mouth. The liquid enters through one nostril and exits through the other. It deeply cleans the sinuses and brings fast relief. High-volume nasal rinses. When mucus is very thick or congestion is intense, high-volume rinses work better. 250 milliliters bottles, low flow, twice a day, even more if the mucus is green. When the mucus clears up, you reduce the frequency. Humidification. Simple methods work. Steam is a great ally. Simple methods. Hot shower steam, a bowl with hot water and a towel. Breathing steam from a safe distance. The towel helps release more steam and humidify the environment better. Be careful with electric humidifiers. Don't use them all night. If you see droplets on walls or windows, the environment is too humid. Use them for 1 to 2 hours, then turn them off. More is not better. This is key. Hydration. Mucus has layers. One of them is water. If you drink little water, mucus becomes thick and sticky. If you hydrate well, mucus flows and drains. Suggested amount, 30 to 50 milliliters per kilo of body weight. If you don't have heart or kidney problems, this really works and very fast. Strengthening the immune system. To prevent relapses, vitamin C, vitamin D, turmeric with black pepper, sun exposure, real whole foods. All of this has scientific backing. Painkillers and warm compresses. If there's pain, paracetamol or ibuprofen, with caution, and something simple but useful. Warm compresses on the forehead and cheekbones. They relax the mucosa and relieve pressure. The sea, a natural ally. If you're lucky enough to live near the sea, take advantage of it. Salt water clears the nose and improves breathing almost immediately. Be careful with decongestants. This is important. Many over-the-counter decongestants dry out mucus, but make it harder. The problem doesn't disappear, it gets worse, and something similar happens with cough. Coughing is a defense mechanism. Suppressing it without reason prevents mucus from being eliminated. It should only be blocked when it's truly necessary. Sinusitis is not just a blocked nose. It's a problem of inflammation, drainage, and habits. Understanding it allows you to relieve it and prevent it from coming back. Hydrate. Clean your nose properly. Take care of your immune system. And don't self-medicate blindly. If this video helped you, subscribe to the channel because we keep uploading clear, practical content based on how your body really works. See you in the next video.